Welcome to On the X. My guest today is Dr. Daniel Amen, one of the most recognized and influential voices in modern psychiatry and brain health. He's the founder of Amen Clinics, which has built one of the world's largest databases of brain scans related to mental health. A best-selling author of more than 40 books, including Change Your Brain, Change Your Life, The End of Mental Illness, and Healing ADD, Dr. Amen's central idea is that what we call mental illness is really a brain health issue. And when you change your brain, you change your life. Today, we'll delve into what happens when the brain is not functioning optimally, how it impacts every aspect of life, and what it takes to heal and optimize it. So here we go with Dr. Daniel Amen on the X. Let's start with, and this is a topic that's of a lot of interest to me personally too, that I've just kind of explored a lot with my own kind of like mental health journey post-service. But you're so much steeped in brain knowledge, so I really want to start there. And this is a very broad question, but at this point, just from sort of a neuroscience perspective, what do we know about the brain versus the mind, right? Like how much of the brain produces the mind, or is that even accurate?
No, your brain creates your mind. And if your brain is not healthy, it's inflamed because you have post-COVID, it's traumatized because you had 1,000 breathing exercises, it's going to negatively impact your mind. So I think of the brain sort of like the hardware of your soul, and your mind is the software. And the first thing is get the hardware right so you can properly program it. And then, I think of our relationships as the network connections. And, I didn't think that really before I started looking at the brain in 1991. So I'm a veteran. I was an infantry.
Oh yeah, that's right. It was in your book. Yeah.
I was an infantry medic, and then I was an x-ray technician in the Army, and then I got out, went to medical school. I did my psychiatric training at the Walter Reed Army Medical Center in Washington, D.C., and love veterans. But, in my training at Walter Reed, we really didn't talk much about the brain, which is sort of insane when you think about it, right? Psychiatrists are the only medical doctors who virtually never look at the organ they treat. So we end up with a very flawed paradigm of making diagnoses based on symptom clusters with no biological data. And I've been trying to change this for 34 years. And I'm like, why is this hard? And ultimately, I'm up against a $500 billion a year industry. And, people don't change that kind of money easily. But ultimately, if you don't look at the brain, you don't know what's going on. And so we have all these doctors flying blind. And that's why last year, there were 340 million prescriptions written for antidepressants without anybody ever looking at the brain.
Yeah. What about some of these other theories about consciousness, though, regardless, something like, panpsychism, this idea that all matter has some level of consciousness, even down to like atoms, right? Or the idea that consciousness is not necessarily produced by the brain, but it's like like a radio that's receiving it from some other, whatever you want to call that, right? That kind of thing.
Well, I sort of like the idea. We actually scanned a channeler when we did our healthy study. And there are not that many healthy people in the world. It was hard to do our study. And this was our criteria: no psychiatric illness at any point in your life, no head injuries, drug abuse, you're not on any medication, and you don't have a first-degree relative, mother, father, sibling, or child with a psychiatric illness. Not that many normal people, but we found a normal woman from Canada. And, oh, by the way, she was a channeler. We
Okay.
had, it didn't mean she wasn't normal. And the theory is when you channel, you have to drop your brain activity so you can be open to the frequency in the universe that you're in fact channeling. And that's exactly what happened to her scan. And then years later, I did a study on prayer. And there's a form of prayer called speaking in tongues, which is channeling the Holy
Mm-hmm.
Spirit, is you're allowing the Holy Spirit to come through you. And we saw the same thing in people who were speaking in tongues. So uh, I think in many ways our brain is a receiver, um, which is why you want to keep it healthy so your life is not full of static.
Yeah. It's just, I mean, I know that this, like, obviously the work you do is kind of on, obviously improving people's lives and things like that. But I had another expert on the podcast here who is a TBI expert, but I've never had a real brain expert. But just, I'm fascinated by this idea. It's something I think about a lot, just how, what the interplay is between mind and brain, because there is an obvious interplay. And certainly I completely agree that the health of your brain impacts the health of your mind. I don't think anyone would argue that, but I still don't know that we know anything about like how it happens, right? How the brain might produce the mind, where it comes from, looking at all the scans you've looked at, looking in there and going, here's where you are in there, that kind of idea. Just fast. I mean, do you think about these things and like, where does you even mentioned the idea of a soul, right? So if you're religiously affiliated, when your body dies and you no longer have a brain, and that theoretically goes somewhere, like how does that work, right? If it's no longer producing this energy, so to speak.
I just read a fascinating study on near-death experiences, and I've been interested in those since 1980 when I was a medical student, and I read a book called Life After Life by Ray Moody. And the study I read yesterday from the University of Virginia was so interesting, and how many people who technically die have a near-death experience and then they're revived. About 20% of them really have problems with reentry. They don't wanna come back, and they don't wanna sort of deal with the nonsense that you have to deal with in life, and it was very frustrating for them. So, I mean, my own personal belief is I think it takes more faith to believe in evolution and random chance than it does that there's some sort of creative design. And when you look at the brain, it is incredibly beautiful and well made. And the second law of physics is entropy. Things go from order
Mm-hmm.
to disorder. And, that's totally true for my teenage son. Um, but uh, yeah, I just think for me, it takes more faith to believe that you and I are having this conversation by random chance.
Mm.
But to go to your question about your mind,
Yeah.
the posterior cingulate gyrus. Do you know that area of the brain?
I mean, I read you're a very prolific writer. I think you have 40 books that you've either I don't even know how you have time to do this based on all the other work you're doing, but somehow you have I'm going to get that. What does it say on your mug?
You're always listening. It's about one of the books I wrote.
Tame your dragons. That's what it says.
Your brain is always listening to the dragons, and the dragons are sort of our big psychological issues from the past that still breathe fire on our emotional brain. But there's an area of the brain called the posterior cingulate. It's toward the back, middle, um, and it's sort of the self-referential part of the brain, the
Mm-hmm.
part of your brain that talks to you, that one of the techniques your listeners will like is give your mind a name, so you just don't have to believe every stupid thing you think. And you can sort of gain a little bit of distance from that noise.
Hmm.
And quieting that with prayer or meditation, psilocybin. I'm not a huge fan of psilocybin, but it drops activity in that part of the brain. So it's like this negative thinker you have, you sort of get a break from him or her. And uh, that is one place where you could say, oh, well, that's the mind coming out or being
Hmm.
expressed. But if you have Alzheimer's disease and that part dies early, it does, you're not quite the same. Your mind is not quite the same. If you have post-COVID
For sure.
anxiety, I've clearly inflammation in the brain. And all of a sudden you're anxious, you're predicting the worst things are going to happen. And it's not you, right? For some people, it's them, right? It's been their pattern their whole life, but not for these people. It's based on inflammation of certain structures in your brain.
You said you weren't a fan of psilocybin. Why is that?
Well, I'm not a fan because I think there are other ways to manage your mind that don't potentially make you psychotic. And going to the emergency room for psilocybin psychosis has gone up 300% in the
Really?
last 5 years. And if we go psilocybin under really well-controlled conditions with experienced therapists, I think probably can be helpful. But what's the problem with that? The kids think it's medicine and they're using it at rave parties. They're using it in dorm rooms. It's, micro dosing, even macro dosing is rampant now. And yet again, we're going to unleash something on society that's going to have big negative consequences. Just like, the lie of benzos or mommy's little helper. Clearly, they're not. They're addictive and they increase the risk of dementia. Or the early 90s, alcohol is a health food. Clearly not. It increases the risk of 8 different cancers. Or pain is the fifth vital sign. You need to be on your opiate. Clearly not. That was a disaster. Or marijuana is innocuous. Clearly not. People under 50 have a 6-fold increased risk of having a heart attack. Yeah, I worry that we get all excited and, there are companies with big valuations producing
Sure.
psilocybin, but it's the messaging to young people who are at historically um, levels of mental health problems that now we're just going, hey, there's another solution that is a short-term solution that I think in the long run is going to get us into more trouble.
You said psychosis. Are you talking about a permanent condition or are you talking about
For
some kind
some
of
people,
temporary?
it is permanent. But,
Really?
but even if it's temporary, I mean, losing your mind just makes it more likely you're going to lose it again. And my experience, and I had one of my really well-known patients who just did great, just decided to pick it up, microdosing, and he's
Mm,
just done terribly. And it's heartbreaking to me when there are other ways to feel better. And
sure.
I love EMDR. It's a specific psychological treatment for trauma. And I often think of it as like psilocybin without side effects
Mm.
because, I mean, you can have these just transformative experiences. And I published a study on police officers who had PTSD. It calms down that same area of the brain.
Yeah, I've done EMDR, and I think it's super effective. I'm a big fan of EMDR, of all of the various, different treatments and things that I've done over the course of my kind of veteran journey. EMDR was exceptionally effective, and only took 2 sessions, I think. I think I did 2 sessions, and I was like, oh, that kind of helped that scenario. Do we? The psychedelic stuff is interesting because there's so many proponents out there. I would actually classify myself probably as one of them, just because I've seen so many people benefit from them. I've done psilocybin a couple of times in a controlled setting. I mean, it was therapeutic. It wasn't at some party or something like that, and it was an interesting experience for sure. I've tried some therapeutic ketamine as well. It's nothing I feel drawn to again. But most of the experiences that I've seen with those things have been positive for people. It doesn't mean that there can't be negative ones. 2 questions, follow-up questions to that stuff. One is on the EMDR front, do we know why it works? Like how it works exactly?
Let's go back to psilocybin just for a second.
Oh, okay.
My experience may be biased because we see people who've had bad trips
Sure.
and flip into more severe psychiatric stuff. And so, I rail against marijuana. Why? Well, because I see people that it's hurt them significantly, right? That's my day to day.
Yeah, sure.
And so, EMDR, how does it work? The bilateral hemisphere stimulation calms down the limbic or emotional brain. So if you bring up a memory while they have your eyes going back and forth, or they're doing alternate tapping, for example, on your knees, or you're holding the devices, and what that's doing is as you bring up the memory, it's integrating the right hemisphere, which tends to hold anxiety, with the left hemisphere that allows you to express what you're feeling. So the left hemisphere is more heavily involved in language. So sometimes you can be afraid or anxious about something and you don't know why. You don't have the words for it. And what EMDR does is it integrates both sides of the brain and at the same time settles your emotional brain. So I've done research on it, and I've recommended it for more than 30 years because I just find it so helpful. But I've had the ability to scan someone before and then afterwards. And if you have a single incident trauma, robbed, raped in a fire, 1, 2, or 3 sessions often just dramatically helps you. If you grew up with an alcoholic parent, you might need 50 sessions because there's a lot of trauma.
Let's kind of back up to what brought you to all this, because you mentioned there in the beginning that you were getting into this and it was like, hey, we've got this field of psychiatry and nobody's looking at or it'd be like a cardiologist not looking at the heart, or basically, right? Something like that. So at that point in your career, what did you do that was different in terms of looking at the brain? And you mentioned the scan as well, which is the SPECT scan is kind of what you use as a diagnostic tool. So talk a little bit about what set you apart in kind of this path you went down looking at the brain. What made the SPECT scan kind of the hub diagnostic in terms of looking at the brain itself, and a little bit about what that is too, for people that have no clue what a SPECT scan is.
So when I was 18, I was infantry medic. Vietnam was going on, and that's where I fell in love with medicine. But about a year into it, I realized I didn't like being shot at. So I got retrained as an X-ray technician. And that was very important for me. And our professors used to always say, how do you know unless you look? How do you know unless you look? And then when I decided to be a psychiatrist because someone I cared about tried to kill herself, um, I fell in love with it because I realized it could change generations of people, right? If you're better, your kids are better, your grandkids are better. And and I'm like, so why aren't we looking? Obviously, the brain is our organ. And they go, oh, that's the future. And when I was growing up, I'm one of seven. My dad's two favorite words, bullshit was the first one. And the second one was no. So any question you asked him, no. So it was bullshit and no. And so I'm like, we should look. And they go, it's the future. And I'm like, well, what about now? And when I had the opportunity in 1991 to look with a study called SPECT, it's a nuclear medicine study. It looks at blood flow and activity, looks at how your brain works, literally changed absolutely everything in my life. From the time I went to bed, to what I eat, to how much I weigh, to how much I work out, to if you date my daughter for more than 4 months, I'm gonna scan you, to going from loving football, played football in high school, was crazy Los Angeles Rams fan, and to realizing it's a brain damaging sport. And when I started looking, everything in my life changed. And I went, well, how would I do this if I didn't look? Right? There's 40,000 psychiatrists in the United States who make diagnoses based on symptom clusters with no biological data. And then they prescribe powerful medications, and the pharmaceutical industry is really smart. They don't want to be in the order business. They want to be in the reorder business.
For
So
sure.
they don't give you things that fix it. They give you things that hook you. And, many people know the withdrawals from benzos or SSRIs are brutal. Now, there is a new exception to this. There's actually a postpartum depression medicine, Zerolone, that you only take for 2 weeks, and it resets things. And
Hmm.
70% of the people only have to take it for 2 weeks. But guess what the cost is?
Oh gosh. I'm gonna guess $300 per pill.
$16,000 for the 2
What?
course. Is that not
Oh,
an
okay. So for 2 weeks. So do the math on that. What are we talking about? That how many is that a pill a day?
Yes.
A pill a day, 16,000. So $1,000 a day. So 1,000. I was off by threefold, a little more.
Isn't that insane?
That's crazy. Yes.
It's but what I'm really excited about is people are going postpartum depression is your brain is not set right, right? And it's basically a steroid treatment or a hormone treatment. And we can reset it and you can be fine. So I think it opens up a whole new area of research where we should be resetting the brain rather than think this nonsense of you have a serotonin deficiency and so you should be on an SSRI the rest of your life, which is ridiculous. And I think of that depression really shouldn't be a diagnosis. I think it's a symptom cluster very much like chest pain, right?
Completely
Nobody
agree.
gets a diagnosis of chest pain. Why? Because it doesn't tell you what's causing it and it doesn't tell you what to do for it. If you gave everybody with chest pain the same treatment, that would be malpractice. And it's ludicrous, right? Because you could have chest pain from a heart attack, from a heart arrhythmia, from a heart infection, from
Yep.
lung cancer. You could
Yep.
have it from pneumonia. You could have it from an ulcer. You could have it from gas. You could have it from grief. And so we don't give people the diagnosis of chest pain. But depression is now the number one cause of disability worldwide But you can get depressed from a head injury. You can get depressed from having COVID. You could get depressed from having Lyme. You could be depressed because you lost your job. You could be depressed because you don't know how to manage your mind. You could be depressed because you're on the standard American diet and your gut is unhealthy. And so making a diagnosis, you have 6 of these 9 symptoms, and then giving everybody on a wholesale level, 25% of the adult psychiatric population's on psychiatric medicine. When you're looking at it from my perspective, you're like, these people are all crazy.
I agree with you 100% on the symptom cluster thing. I've been saying that for a long time. It's like I give a different examples, but with depression, it would be equivalent to you go into your doctor and you say, I'm sad all the time. And they say, oh, well, you're depressed. And if you didn't know what that meant, you'd say, well, what does it mean? What's that mean? It means you're sad all the time. You'd be like, yeah, I know that. That's what I just told you. Like, why, right? That's the problem is I don't understand why. And I think that applies across the board with so many mental health things. Go back to the SPECT scan though, because I think there's a lot of people out there that have no clue what it is. When we think about trying to your point, look at the actual brain, there's different tools that people probably know about. You can do an MRI, you can do a CAT scan. Those things can structurally look at the brain. You can slice it up and kind of look at the structure. But a SPECT scan is different in that you're actually looking at sort of activity and blood flow, as I understand it. So break that down a little bit for people that don't know what that is.
It's based on a concept called regional cerebral blood flow that it's a nuclear study. So we take a very tiny dose of a radioisotope, connect it with a substance that's easily taken up by cells in the brain, inject it, and SPECT is single photon emission computed tomography. Those the radioisotopes produce little pieces of light. They're called photons. And those little pieces of light, they lock in your brain and then they send out signals, sort of like flashlights in a raft. And each image is made up of about 10 million counts or times the photons hit the crystal in the camera. So we get these very sophisticated images, and they basically tell us 3 things: good activity, too little, or too much on every area of the brain. And an MRI or a CT scan, they, as you said, look at structure. SPECT looks at function. And most psychiatric problems are not structural problems, they're functional problems. Parts of your brain work too hard, like in OCD or PTSD. Parts of your brain don't work hard enough, like in ADHD or traumatic brain injury or different forms of dementia. And when my first case was a 40-year-old woman who tried to kill herself the night before. And as I sat with her, I actually didn't think about a scan. I just came from a lecture, my first lecture on SPECT. I thought she had adult ADD. Had an IQ of 144, never finished college. She had an 8-year-old son who had ADD, and the suicide attempt was impulsive after a fight she had with her husband. And as I'm listening to her, I'm like, I think you have ADD. And she goes, oh, adults can't have ADD. And I'm thinking to myself of like, wait a minute, I'm the doctor. And I said, well, would you mind if I looked at your brain? And I'd already been doing studies with something called quantitative EEG. And so I knew ADD is not a disorder of a resting brain, it's a disorder of a working brain. So I did one scan at rest, one when she tried to concentrate. And when she tried to concentrate, the front part of her brain dropped in activity. And I put the scans on a table in her hospital room. And as I explained it to her, she started to cry. And she said, you mean this is not my fault? And that was the moment I got hooked on imaging. And I said, having ADD is sort of like people who need glasses. People who need glasses aren't dumb, crazy, or stupid. Their eyeballs are shaped funny. People have ADD. When they try to concentrate, their brain shuts down rather than turns on. And you're not dumb, crazy, or stupid. We just have to support the function in your frontal lobes. And she just did remarkably well. But it was that moment that hooked me on imaging because immediately it decreased shame. And the other thing that hooked me, I just did a podcast with Julius Randle, the three-time NBA All-Star, who I dearly love him. And he saw his scan and it was toxic. And that day he stopped using marijuana.
Mm.
And marijuana was a huge part of his problem. He was on the verge of getting divorced because his wife said he wasn't him anymore. And can you believe you can play in the NBA completely high? Because they don't.
Sure. I can believe that, actually. Just real quick, I just want to clarify on the SPECT scan thing. So is it showing blood flow? Is that when you're looking at activity specifically, is it a blood flow thing that you're seeing, or is it like an electrical activity
No, it's
thing?
not electrical. QEEGs
Okay.
look at electrical activity, but 49% of the tracer force SPECT is taken up in the mitochondria. So you're really looking at metabolism.
Okay. Got it. So then I want to go to this point you kind of made in there, or at least implied a little bit, which is something I think about all the time regarding the brain and the mind, which is how much of what we're dealing with is some kind of genetic predisposition or just luck of the draw, like you were kind of talking about, stuff that isn't quote unquote our fault, right? Like we had nothing to do with it. And how much is because clearly our behavior, I mean, you talk about this in your writing, your behavior changes your brain. You can do things, you can act in ways to impact your subconscious, unconscious behavior, right? It's a learning machine. It's a prediction engine. And so that means that we can impact it through what we're doing. But then the question is, did the behavior in the first place, was it sort of planted in there, so to speak? Or how much is a result of what we've done I always run into this chicken and egg problem. Like what started the whole kind of thing, right? Because I can see the upside to someone saying, this isn't my fault. Sure, that's a relief. But I can see the flip side to being powerless, saying, well, I'm just a victim of my brain. There's nothing I can do, that kind of thing. And I always like the idea of being empowered.
No part of my work would go, there's nothing you can do, right? My work is all about hope. And
sure, of course.
And once you know better, you should do better. But a lot of times it's really not your fault because, for example, I adopted my two nieces because both their parents are drug addicts. And, if your mom drinks when you're pregnant,
Sure.
that gives you big issues. And there's a concept that you might like called brain reserve. And brain reserve is the extra tissue you have to deal with whatever stress comes your way. And brain reserve is building even before you've been conceived. So if a teenage boy smokes, for example, his children are more likely to be obese. Now, is that the child's fault? I mean, it's an epigenetic phenomenon. If mom is stressed or gets multiple infections during pregnancy, that decreases your reserve. And then, when you're born, is it a good birth or a bad birth? Because, that day is filled with trouble for a lot of people. Are you born, one of my kids was born with the cord wrapped around her neck. And did that have something to do with the learning disabilities that she struggled with? Maybe. there's so many things that are either building your reserve. Do you have good educational opportunities? Do you have
Hmm.
parents that like you? Are you um, living in a home with an alcoholic parent? Right? All of those things are either building or stealing your reserve. So if you think about two soldiers, put them in a tank in Iraq, and they experience the same blast, the same angles, the same intensity, everything's the same. One of them walks away unharmed, the other one's permanently disabled. Why? It depends on the reserve they
Yep.
brought into the accident. And resilience, in large part, I think, is related to reserve.
Yeah. Yeah. I think I maybe misspoke a little bit there in the sense that it can be good to hear. And for sure, we're obviously born with different proclivities, different talents, different abilities. Right? I always say like I can train at running until like with the best trainers in the world and the best supplements and all of that, and I'm still never going to be as fast as Usain Bolt, right? No matter what I do, I'm never going to be that fast, right? He's just naturally faster than me. And the same is certainly true with everything else that we have in terms of our features and our abilities and all of that, for sure. But the thing that I'm getting to there is then what you do is then tell people, okay, but here's what you can do to change that, right? Like this may be the result of something you were born with or trauma you experienced as a child or head trauma or something like that. But here's the different things that you can do. Before we get to that, the other thing I just wanted to touch on from something you said previously was you've talked about this in your book there. Your original book, I think, is the one I read. I was asking ChatGPT, which one, this guy's got a gazillion books. Which one should I read? So like, read this one. This is kind of like the quote unquote Bible of this stuff. But you've had naysayers and pushback on what you do and this whole idea even of why. What's the pushback? That part I don't understand. Like, I can't imagine why someone would think looking at your brain in relation to your mental health and your physical health as well is a bad idea.
Well, if you read the book, The Structure of Scientific Revolution, what's happened to me has happened to many other people who try to change their field. Um, Machiavelli, back in the 15th century, said there is nothing more dangerous than trying to change a system because there's a lot of money entrenched into keeping things the way they are. So if you really listen to the pushback, they'll go, there's not enough science. So I've published 90 studies, the world's largest imaging studies. And if you go on pubmed.gov today and just type in brain SPECT, 16,000 scientific abstracts. So it's like, don't tell me there's not enough studies. I mean, you might not like the studies, but odds are if you're criticizing me, you haven't read them.
Mm-hmm.
It's like, oh, well, he makes money. It's like, so it's like, that's just dumb. And there's radiation. Yeah, it's a nuclear medicine procedure. There were over 1 million of them performed last year in the United States. It's a normal medical amount of radiation. Um, but what they don't say is he's trying to change a field that never looks at what it does. Don't you think that's crazy? Um, yeah, so that's most of the pushback, and it used to really bother me. I was not built to be a disruptor. I'm one of 7 children. I'm in the middle. I like peace. I don't like it when people are mad at me. Um, so I really had to develop a thick skin because the attacks have often been brutal. But, now I'm 71. It's been sort of fun, to tell you. In 2005, 2020 came to my office, and they start the interview with, Dr. Brad Peterson from Columbia says you should be arrested for your work. That's how they start the interview. And
Arrested? For
arrest.
what?
And, I was on the speech team in college, and my speech coach said, when you don't know what to say, take a breath, smile, it'll come to you. And I said, oh, that's so interesting. Last week, someone told me I should win a Nobel Prize. This week, you're telling me I should be arrested. Sort of keeps me balanced. And last year, Brad Peterson, the same one that said I should be arrested, he and I published a big study in a Nature journal on SPECT and depression. So I love sort of seeing people come over to my side because I'm right. Right? I mean, when you're right, that if you don't look, you don't know. We should stop lying about that. And the brain is an organ, just like your heart is an organ. You need to stop calling people mental. Nobody wants it. And help them have a better brain. Everybody wants that. So what if mental health was really brain health? And if you think about, those of us that were in the military, none of us in the military wanted to go see the shrink, all right? Nobody wanted to be defective unless they were trying to get out. But everybody wants to perform better. And so what if mental health was brain health? And that's sort of the big mission of my life, is to end the concept of mental illness by creating a revolution in brain health. And that's what I'm so excited about. I'm working with RFK Jr. and the White House Faith Office on creating a national brain health revolution. And it's all based on one question. Like if you just asked yourself this one question every day, is what I'm doing today good for my brain or bad for it? And if you could just answer that with good science and love of yourself, love of your family, love of the reason you believe you're on the planet, you just start making better decisions. You would sleep better, you would eat better, you would interact in more positive ways.
For what it's worth, I've had a SPECT scan, not through your office, but I did it through, I think, a nonprofit. This was years ago. And it is a little bit like off-putting because, there's this, I don't know, it may have progressed since then, but there's this little container and it's got like the radioactive symbol on it. And it's like, okay, here's what we're putting into you. But like you said, what is it in terms of radiation that you get? People always do X-ray equivalents. What's kind of the equivalent amount
It's
of
the same
radiation?
as a head CT.
Okay. Which I've had those too. So, okay. Yeah. So,
but how did it come out?
My SPECT scan? I don't know that I ever got a lot of analysis on it. I'll be honest. The feedback that I remember anyway, there just wasn't much follow-up to it because I feel like it was part of a study where I was going to go do something and then go back and get another one. And it may have been because of COVID where I didn't go back and get the second one. I never did, but I can't remember exactly why. I think it was, if memory serves, I think it was in conjunction with hyperbaric oxygen treatment. I think is what it was.
I love hyperbaric oxygen.
I think I did. I think it was that. So I did, and it was. This is what. Sorry, it's coming back to me now. It was during COVID. So I went down. It was in Florida. I got this SPECT scan, and the quick analysis on it that I got was that if there was an area of damage or flow, was the underside basically of my brain. They were basically like, it looks like you got whiplash. And I said, well, would you get that if you were in like really high speed boats smashing off of 10-foot waves for hours at a time every single day for years, like with your head whipping back and forth like they're like, yeah, that would probably do it. So I'm like, okay, that correlates. That makes sense to me. Then I went and did the hyperbaric oxygen. It was 3 weeks, two treatments a day, 1 hour treatments that I did, 40 treatments, I think.
Mm-hmm.
But then I didn't go back and get the after SPECT scan. And I think it just was COVID related, I think. But
it makes a difference. It's one of the reasons I love hyperbaric.
Sure. Yeah.
because it helps improve. Um, was this in Jupiter, Florida?
Could have been. I don't remember. This is
Yeah,
probably five,
because I
6 years
know
ago at this
Joe
point.
Namath went there, and his brain was terrible, and he was terrible. He did 40 sessions. His brain was better, 40 hyperbaric sessions. Then he did 40 more hyperbaric sessions. His brain was better still. And they did 40 more. So he did a total of 120, and his brain was normal.
What do you like about hyperbaric? There's a lot of people that are against, or not against, but there's a lot of people that I would say believe that there's no value there, that it's good for wounds, burn victims, things like that, but that there's not a lot of value in it. So what have you seen? I'm curious from a scientific perspective on hyperbaric oxygen.
Well, I have 20 years of experience with hyperbaric oxygen. I published a study on soldiers showing significant global improvements in blood flow.
Hmm.
So I'm a huge fan. I'm a fan of soft chambers. If you can't go to a hard chamber, I think hard chambers are better. But there's the difference between what's better and what you'll actually do.
Yeah.
Yeah, I have hyperbaric chambers in all my clinics. If I sprain my knee, I'm going in the chamber. If I had a concussion, I'd go in the chamber. If I had surgery, I'd go in the chamber. I'm a huge fan. And for the people who don't believe in it, what it generally means is they haven't read the science.
Mm.
That there's wonderful scientific evidence. It decreases inflammation. It promotes stem cell production and growth. It increases angiogenesis, which is sprouting new blood vessels. Yeah, it's one of the main things I recommend for people who've had traumatic brain injury. And, let's just talk a little bit, if it's okay with you, about CTE, because
Sure.
the messaging around CTE is flawed. So chronic traumatic encephalopathy, what we think of as football dementia or boxer dementia or soccer dementia from repetitive head trauma. And I would argue Navy SEALs should have a high incidence of CTE because of the breaching exercises that they do. It's just, it's a mild traumatic brain injury every
Mhm.
time you do that. And did you hear about the kid who went to New York recently with a suicide note that it was the NFL's fault that he had
Yes.
CTE, and he killed those 4 people? And it's the messaging that's flawed. So yes, repetitive trauma, that's bad for your brain. And if you don't do anything to reverse it, it's chronic, progressive, but it's not untreatable. That's the lie. What we've seen, I've scanned and treated 400 NFL players. 80% of our players get better when we put them on a rehabilitation program. And that's what I want people to hear. As a Hall of Fame football player, learned about my work, and he goes, "No, I don't want to know." And I'm like, "No, you want to know, because if you knew a train was going to hit you, well, wouldn't you at least try to get out of the way?" And so many people, if they get it early enough, can reverse the negative trajectory that CTE plays in the lives of way too many people.
Talk about different ways that, so let's just go with brain injuries, right? Or sort of not even injury necessarily in terms of kinetic injury, but just things that we do to damage our brains potentially and the functioning of our brains. Obviously, so we talked about kind of, hey, you might have had alcoholic parents or drug addict parents, and that set you back in some way. Or you may have had, obviously there's a trauma aspect to this too. But in terms of things, I guess, that physically do it, whether it's something like that, football, something we eat, exposure to toxins, that kind of stuff. Like, what do
So
you
I
see
have
that are
an
the biggest
acronym
contributors?
I talk about in a lot of my books. And actually, I have
Yeah,
a new book I didn't even tell you.
I know. Well, I'm waiting till the end. I was
And,
going to let you. I was going to let you promote it at the end of the
well, thank you.
interview.
But in all of my books that I've written probably in the last 10 years, I talk about bright minds You want to keep your brain healthy or rescue it, you have to prevent or treat the 11 major risk factors. And it just sort of gives that frame. Brain health is three things. Brain envy, got to care about it. Freud was wrong. Penis envy's not the cause of anybody's problem. The only organ where size matters is your brain. So care about it. Avoid things that hurt it and do things that help it. You just have to know the list. And, a decade ago or so, my team and I came up with Bright Minds. So B is for blood flow. Anything you do that decreases blood flow is bad for you.
Mhm.
Smoking, excessive caffeine, high blood pressure, being sedentary, bad. R is retirement and aging. When you stop learning, your brain starts dying. I is inflammation. Flossing is a brain health exercise, because if you have gum disease, you have inflammation.
I do a lot of flossing.
Low omega-3 fatty acids, an unhealthy gut, processed food, sugar, all promote inflammation. The G is genetics, and I think we don't think about it right. Like, I have heart disease and obesity in my family, but I don't have heart disease and I'm not overweight. Why? Because I'm on an obesity, heart disease prevention program every day of my life. So know your risks. H is head trauma, we talked about. Brain is soft, skull is hard, skull has sharp bony ridges. Don't let your kids hit soccer balls with their head. Very stupid. T is toxins, as you mentioned, and alcohol, marijuana, mercury, mold, general anesthesia, pesticides. M is mental health issues, so adverse childhood experiences, or if you're negative, negativity is bad for the brain. I is immunity and infections. COVID obviously created a lot of brain issues. N is neurohormone disorders. Why, if testosterone levels dropped 1% a year for the last 50 years? I mean, that's just nuts. I think it's related to the toxins. D is diabetes. 75% of Americans are overweight or obese. If you're overweight or obese, you have all 11 risk factors. And S is sleep. So if you want to know what to do, exercise, new learning, omega-3 fatty acids, kill the sugar, be serious about whatever your genetic vulnerabilities are, don't text and drive, support the 4 organs of detoxification. So I'm going to a sauna in a little bit. Saunas are great for the brain. Don't believe every stupid thing you think. Know your vitamin D level. Optimize your hormones. Like, test them every year. Be careful what you eat. It's so important. And go to bed early.
Talk about why omega-3s. What do those do specifically? You're obviously a very big proponent of it. Like, when I read the book, it was like it didn't matter what you were talking about. It was basically like omega-3s are a good idea. Why? What do they do?
And
exactly?
90% of us are low in omega-3 fatty acids. They make up a very large percentage of nerve cell, brain cell membranes, and low levels of omega-3 are associated with dementia, depression, ADHD, and it's such an easy fix to, eat more fish or take fish oil. I think fish oil is actually safer because it won't have all the toxins
Yeah,
in
I
it.
agree.
If you have a high quality brand, what most people don't know is if you tend to be depressed or have ADD, take fish oil that's higher in EPA as opposed to DHA. If you're more anxious or have memory issues, DHA seems to be better. But I think get one that's balanced.
Yeah, I got one on
And
my desk right here, actually. So
yeah, no, I think everybody should take a multiple vitamin. Everybody should take an omega-3 fatty acid, and everybody should know and optimize their vitamin D level.
I do want to, because I'm a soccer player, I want to touch on the heading the soccer ball thing, because this is one of these things where, like, I'm sure it's not good for your head to do that. Like, banging your head into anything isn't good. But I grew up doing it. My kids have played soccer. One of them still plays soccer. It's something that billions of people on the planet play, and we don't have billions of people with CTE from soccer. I'm sure there are some soccer players that end up with that based on, but like, how bad is that? Like, are we talking like, should we just ban heading the soccer ball in all of soccer? Really?
We should.
Yeah.
Well, just think of the physics of it. Your brain is soft, about the consistency of soft butter.
Yeah.
Tofu, custard, somewhere between egg whites and jello. And
I'm getting
your
hungry just with everything you're saying.
skull is really hard and has sharp, bony ridges. And your brain is not anchored into your skull. It floats in water and cerebral spinal fluid. And so every time you hit a soccer ball, and soccer balls are not volleyballs, they're not light. They have weight to them.
Yeah.
So every time you hit it, your frontal lobes are smashing against your skull. That's not good for you. And in my book, You Happier, I did a study of 500 consecutive patients. And if you had low frontal lobe function, you were unhappier. I published a brand new study on negativity. If you have low frontal lobe function, you're more likely to be negative. You're more likely to have less hope. What is hope? Hope is agency. This is not a good thing. This is the most human, thoughtful part of us, is the front third of our brains. And it's involved in 91% of concussions, your frontal lobes. I think we have to love it, protect it, nurture it. Ping pong is great. Golf is good. Tennis is terrific. There's so many things we can do to get out our competitive nature that don't involve damaging the most human, thoughtful part of ourselves.
Mm-hmm. How do we go around, though, not just terrified with all of this stuff, though, like without bubble wrapping our head and just being like, oh my God, I'm just anything I do? Because regardless of what you do, I feel like almost everybody who's active, who's going to play sports, who's climbing a tree, who's just a kid in general, at some point you bump your head on something, right? Like you
all of us do, and most of the time it heals.
Yeah. So go to that point.
Is repetitive.
Okay.
And purposeful. And that's why they banned it for kids under 11.
Yeah.
And I'm like, well, why don't you like 12-year-olds? Right? There was no neuroscience to picking under 11. There was not, that's what they could do politically. But your brain is actually not finished developing till you're 25.
Right.
But I treat still a lot of NFL players, and they're like, Doc, we're going to play. Right? I have one guy signed an $80 million contract. And it's like, okay, then let's always keep your brain in a healing environment. We're just finishing. I have a nonprofit foundation called the Change Your Brain Foundation. And we put 100 firefighters through Amen clinics, and almost all of them had wickedly bad brains. Now, does that mean we're not going to have firefighters? Well, I hope not. But what it means is firefighters should always be rehabilitating or putting their brain in a healing environment. So if you spent the rest of your life with every day you ask the question, good for my brain or bad for it, and you chose good 19 times out of 20, your life would be better, not worse. I have a high school course called Brain Thrive by 25, and we teach kids to love and care for their brains, and it decreases depression and drug abuse, and I'm very proud of it. And week 4, we go, so these are the things that hurt your brain. And invariably it's a boy, it's never a girl, raises his hand and goes, "How can you have any fun?" And
Right.
we play a game with the kids called Who Has More Fun? The kid with the good brain or the kid with the bad brain? And I guarantee you it's the kid with the good brain has more fun.
In the last couple seconds here, plug your new book, because you got a new book, and you held it up to the camera there for a second, but get more into it. What are we talking about there? Change your brain. You've sort of trademarked this: change your brain, change your X, whatever it may be. So what is this one specifically diving into?
This one's on pain.
Mhm.
It's on the intersection of physical and emotional pain. And what we discovered is that physical and emotional pain run on the same circuits in the brain. And if you can get your brain healthy, you hurt less physically and also emotionally. And the star of the book is the doom loop. It's really the fear of pain that accelerates pain and holding on to repressed rage that keeps pain going. And
Mm-hmm.
so in the book, I help people let go of some of the repressed rage. I help them get their pain circuits as healthy as it can be. And, one study that just blew me away, people my age, 80% of us have abnormal backs, but who have no pain. So that's the really
Yes.
important thing. They
Yeah.
have no pain, but their MRIs are abnormal. So many people have pain, they go get an MRI, their
And they're
MRI is
fine.
bad, and they go get surgery. And I'm like,
Yeah.
you might want to wait and see if these other things might not be helpful, because I believe your body is always trying to heal itself and figuring out ways around the pain rather than, oh, you have arthritis, so you need surgery.
Yep. I'm so with you on this. And this is why, again, I could talk to you for another 2 hours, because I have a whole bunch of other stuff that I'd love to get into, but I'll let you go. Maybe we can get you back at some point. I think the biggest thing, my biggest takeaway that I think is important for a lot of people, especially veterans, to hear, and you didn't say it explicitly, but you basically did, which is so often we think that a TBI or something like this is a death sentence, it's a permanent situation, and it's not. Your brain can heal from these things. You can do things to make it better again, which I think is a really important thing.
You are not stuck with the brain you have. Every day you're making it better, you're making it worse with the behaviors you're engaging in. I did the big NFL study. 80% of our players were better. These are people with seriously bad brains.
Yeah.
Even if you've been bad to your brain, and we know, both being veterans, that there are a lot of things in the military that are harmful for your brain, whether it's the blasts or the emotional trauma or the toxins you're exposed to, or just the unlimited Baskin Robbins they served in Iraq. Clearly bad for your brain. It can be better. And
Yeah.
it's always starts with that one question: what you're doing now, good for your brain or bad for it? Choose good.
Thanks for listening to On the X, the official podcast of the Navy SEAL Foundation and an Ironclad original series. Learn more at NavySealFoundation.org or text On the X to 60104. Please like, share, and subscribe. See you next time.